On the Health Watch, the World Health Organization has declared Mpox a global public health emergency for the second time in 2 years.
This follows the spread of an outbreak in Africa originating from the Democratic Republic of Congo. Joining us now to discuss is Dr. Shivanjali Shankaran, an infectious disease specialist at Rush University Medical Center. Doctor, thank you for being with us.
Thank you for having me.
Can you explain for our viewers what Mpox is and why the WHO is now so concerned about another outbreak?
So Mpox is a viral infection that spreads via close contact, and it can cause painful rashes. We've been dealing with an outbreak since 2022. The reason the WHO has put out another public health emergency is that a second strain that belongs to Mpox clade 1, which has been known to have more severe disease as well as a higher mortality rate, has been spreading pretty quickly through the Democratic Republic of the Congo, and it has also spread through some of the nearby countries. And the PHEIC is to help the different countries around the world be ready, and also to help increase the number of vaccines and other resources that can be provided to the countries that are dealing with the highest number of cases.
What is the risk for another outbreak here in Chicago?
The general risk is very low, and however, we're very connected right now. It's easy to travel from place to place. So far, only 2 cases have been identified outside of these few countries in Africa. So they've had 1 case in Thailand and 1 in Sweden. However, we're still dealing with cases belonging to the 2022 outbreak strain. The numbers are very, very low. There are some people who meet criteria who should get vaccinated. These criteria are available on the CDC as well as the health department. And so if you meet those criteria, you should get the vaccine. But the general risk from the clade 1 is very low at this time.
So, Doctor, you walked through some of the actions that are being taken to keep this outbreak under control. What's at risk if people fail to act on this, if the World Health Organization isn't doing what it's doing right now?
I think we already saw what happened in 2022, where they did have the public health emergency, and we've had 100,000 cases around the world, and so that's the big fear. Obviously, there's been thousands of cases within the DRC. I believe they've had several hundred deaths already, and so the idea is to provide the resources and help in the countries that are struggling the most and have had the most number of cases to obviously help the people there, as well as to decrease the likelihood of spread around the world, and sort of all of us scrambling to try to figure out what to do and how to protect the people that we're taking care of. So there's that potential, and the more we can do in the countries that are currently facing this, like the DRC and the surrounding countries, the better it is for everyone involved.
So we all want to know what we can do to protect ourselves. What would you suggest?
Currently, there's really not sort of a lot of things additional that you have to do. Like I mentioned, if you do meet those criteria, you should get the vaccine. There is a travel health advisory just to take sort of common sense precautions if you're traveling to the countries like the DRC and a couple of surrounding countries. Those would be the main main things that you have to do. If there is an exposure to somebody who has Mpox, then you should seek care immediately. There is a vaccine that can be given after exposure to help decrease the risk of getting Mpox.
Dr. Shankaran, thank you so much for your time and your expertise on this topic. We appreciate it.
Thank you.